My name is Chris Owens, and I'm the Associate Vice President for Health Sciences at Idaho State University. And today I'll be talking a little bit about COVID-19 vaccines. COVID-19 vaccines work a little bit differently from the way other vaccines work. They are referred to sometimes as messenger RNA or mRNA vaccines. And what that refers to with that mRNA is the fact that the mRNA is actually instructions about the coronavirus, specifically the spike protein on the coronavirus, where what happens is when you're given this vaccine, the immune cells then are able to recognize what a spike protein is on a coronavirus. And then when you are exposed to, if you're exposed to the coronavirus, your body then recognizes that particular protein and then is able to fight that off and neutralize it. And in that sense, the mRNA is basically instructions for your immune system to know what to do if it encounters coronavirus, and then to be able to successfully fight it off. And the other really important point about this messenger RNA is it is very short-lived. That messenger RNA delivers the instructions that it's supposed to deliver. The cells see what they're supposed to do. They build that immune response, and then the messenger RNA itself goes away. It almost has what's like a self-destruct. It just goes away. And then from then on, the body is still immune to COVID. And when you are exposed to the coronavirus, you will be able to recognize and neutralize the virus. And this is based in some theoretical concerns about the possible similarities that might exist between the viral spike protein and an important protein that's found in the placenta. So, right, if they were close enough in the way that those proteins are constituted, and a vaccine could destroy the spike protein, could it then possibly destroy this really important protein in the placenta? That was the question, right? That was the concern. As it's been looked at, though, there is no evidence to suggest that these two proteins are similar enough to cause any kind of problem. In fact, they are different. So the protein structure of this important protein in the placenta is different from the spike protein on the coronavirus. Therefore, the COVID-19 vaccines will not harm these placenta proteins and will not cause problems with fertility in women. There's no evidence whatsoever to suggest, and there's no reason to believe that either COVID the disease or COVID vaccines result in infertility. Well, as I think about just in general why people should get vaccinated against COVID-19, I think a little bit just about the public health and scientific advancements that we've made in the last 100 years that have really made a difference. When you think about those things that really have made life what it is now for us, living longer and healthier than people ever have, you can think about, well, what are the reasons for that? And of course, things like having access to clean drinking water and safe food supplies and safer working environments and a whole host of things we now know, not smoking. I mean, there's lots of things that we know that have helped people live longer, healthier lives. But vaccinations really do top the list as public health interventions that have greatly improved the quality of life for people all over the world. We don't worry about polio. We don't worry about smallpox. We don't worry about measles or tetanus, or we don't even worry about the flu so much because we have a yearly flu shot that is available to us to prevent these kinds of diseases and sicknesses that years ago people did have to worry about. I would put COVID-19 vaccines obviously right alongside the other vaccines that are out there. Vaccines have done a lot of good. And the truth is, these COVID vaccines will do a lot of good as well. They already actually have, and we've seen that in thousands and now millions of people. And frankly, our best chance of getting this pandemic behind us for good is for as many people as possible to get vaccinated.